Good afternoon, and thank you for the opportunity to present at the International Congress of Health Education and Research. My name is Dr. Valerie Julius, and I will be presenting an exploratory study of obstetrics trainees' experiences of breaking bad news. Breaking bad news is one of the most difficult tasks performed by doctors. The news can significantly impact the patient, however, this task also generates stress for the doctor. A recent survey of Irish obstetrics trainees found that most trainees felt out of their depth breaking bad news despite receiving training. The aim of this study was to explore the lived experiences of breaking bad news for obstetrics trainees in Ireland. It is hoped that the insight gained from this study will help to develop an understanding of what trainees need to know in breaking bad news training. A qualitative study was performed using interpretative phenomenological analysis, or IPA, to capture the experience of the trainees. Ethical approval was received from the Royal College of Physicians of Ireland. Semi-structured interviews were performed over Zoom, which were video recorded and audio transcribed. Data were analysed in line with IPA using in vivo software. This involved reading and rereading the transcripts to generate emergent themes, then identifying connections across the themes before moving on to each subsequent transcript with fresh eyes. Patterns across accounts were investigated to develop superordinate themes which encompassed the shared experiences of the participants. As a current trainee in obstetrics, I came to the research with my own preconceptions and personal experiences of breaking bad news. I kept a reflective diary throughout the study to acknowledge this. My supervisor, Professor McCarthy, conducted a validation check, comparing the final themes with the codebook to confirm that they were representative. 7 trainees were interviewed, including 3 male and 4 female trainees. The study involved a mixed experience sample, including 5 trainees on the basic specialist training programme who were in the 3rd year and 2 trainees at different stages of higher specialist training. 4 superordinate themes were identified that encompassed the data from all 7 participants. These were the reality of work in obstetrics, the role of the doctor, development of communication skills, and the importance of the patient experience. The first theme related to the nature of working within the field of obstetrics and the challenges that this presented while breaking bad news. 2 trainees described the challenges of trying to communicate sensitively in emergency situations. Within the context of a busy day, breaking bad news can be particularly difficult, with competing clinical duties and little, if any, time to process the events. Other challenges specific to obstetrics relate to the sensitive nature of pregnancy and pregnancy loss, invoking a range of emotions. The next theme explores the role of the doctor and how this plays out in breaking bad news. The trainees describe their professional role and how they fulfill this within the context of breaking bad news. Confidence in diagnosis was important, and this increased over time. Attributes required for breaking bad news include empathy, kindness, compassion, and optimism. Breaking bad news could have an emotional impact on the trainee, which could persist for days, although only 2 of the trainees mentioned ways of coping with this. Senior doctors have an invaluable role to guide and mentor trainees, particularly in the early stages. The third theme relates to development of communication skills. Trainees were asked specifically about their training in breaking bad news. 6 trainees reported receiving undergraduate training, and only 3 acknowledged receiving postgraduate training in this area. Trainees also developed their skills through informal means, whether by observation, through experience, or learning from peers. Most felt that more formal training was needed, which should be tailored to obstetrics. The fourth theme relates to the patient experience and the impact that this has on the trainee's experience. Every trainee discussed the patient experience, and this theme included many codes across the cases. They universally acknowledged the need for a support person during the consultation. They were also aware that the way that bad news is delivered matters and impacts heavily on the patient experience. Trainees break bad news in a variety of clinical situations, ranging from cancelling surgery to diagnosis of fetal loss. They expressed a strong desire for more formal training with a focus on obstetrics. A number felt that a mentor or buddy system could be helpful in the early encounters. Breaking bad news can be emotionally draining, although there was little reference to supports available or accessed. Breaking bad news training can be effective in preventing emotional stress for patients and doctors. Course providers should continue to seek input from trainees to ensure that training meets their needs. This study provides an insight into factors that influence trainees' experiences of breaking bad news. The results complemented existing literature and raised questions about how to best support trainees through increased training and psychological support. These are my references. Thank you for your time and attention. I include some participant quotes now. Thank you again.